10:02, so we will go ahead and get started. Good morning. Welcome to our Basics of Meritain Insurance presentation today, facilitated by our very own insurance representative, Morgan. Before we get started, go over a few house rules as far as Zoom control so we can make sure that your experience is great. First, you'll see the unmute to mute and unmute yourself. You'll see it at the bottom left side of your screen. That is indicated by arrow 1. To turn your video on and off, that is also indicated at the left side of your screen, and that is indicated by arrow 2. If you would like to use the chat to ask questions, you can, it's right in the middle of your toolbar at the bottom, indicated by arrow 3. If you like some of the information that Morgan is saying and you want to give her a shout out, you can always do a little reaction at the bottom of your screen, indicated by 4. And then again, if you want to ask some specific questions to Morgan, you can use the Q&A feature so that you can direct your questions to her. And that's indicated by arrow 5. And then for your viewing experience, you can, if you want Morgan to be at the center of the screen while she's talking, you can change your view with arrow 6. And also, Morgan will be at our health fair May 20th from 11 a.m. to 2 p.m. We'll also be sending some info about the health fair in upcoming weeks and links to register. And then just as far as some upcoming DU courses, tomorrow we have your guide to public service loan forgiveness. So if you choose to attend, you'll gain insights into the application process and learn more about the eligibility requirements. We also have basics of standard dental insurance. That one will be February 26th. And then finally, we'll have business communication, which will be February 27th. And both of these are on Zoom. And then finally, we will be doing Spirit Week, which is our own turn of employee appreciation, March 3rd through March 7th. So I know that was a lot. So if you have any questions, please drop them in the chat and we'll be able to answer them. And with that, I'll go ahead and pass it over to Morgan.
Awesome. Thank you guys. And thank you again for having me come and go over this. This is the best part of our job. But like you said, I'll be at the health fair too. I was there last year. I really enjoyed it. So I'm glad you guys had me out last year and looking forward to be there this year. So can everybody see okay? I assume so, but so like she said, we're just going to kind of go over the basics, basics of insurance, basics of your insurance. So first, okay, hold on. All right. There we go. Okay. Whoops. I did it again. Here we go. Hold on. Sorry. We're going to get there, I promise. All right. So understanding your healthcare plan is very important, obviously. Just knowing, being good, intelligent consumers of your insurance. So excited to go over this with you guys. So just some basic stuff that we're going to go over is preventative care, prescription benefits, your network, wellness, and then your specific benefits, and then the online resources that you guys also have. So first is, who is Meritain Health? So I know you guys have had us for a little bit now, but I know it can get a little complicated. So Meritain Health is an independent company of Aetna and CVS. So Aetna, we were bought out by Aetna many moons ago. And then about, I think I want to say 2017, 18, CVS bought us out. So honestly, it just kind of makes it the best of all worlds. So you guys have the greatest network, one of the greatest networks with Aetna, and then CVS. So you're getting really good discounts through your pharmacy, having CVS as well. We're one of the nation's largest administrators of health benefits. We're really proud of that. We have 1.3 million members nationwide, and we're a third-party administrator. So basically, your employers are able to customize their benefits to have lower costs for your health care. So first part, let's go over some preventative care. So preventative care, and combined with your healthy eating and exercise, early detection is the keys for long, healthy life. Routine screenings and checkups, that's covered at 100%. For the ladies, mammograms, pap smears. For the guys, those PSA tests, very crucial. During COVID, we know that a lot of things were shut down. You weren't able to get those preventative screenings, but now that everything's up and running again, definitely want to make sure that we're going out there and checking before anything has any chance to develop. All right. Next one. So some just basic in, how to stay healthy, obviously avoiding tobacco use if possible, trying to eat healthy diets and maintain healthy weights, staying active and exercising regularly, limit the amount of alcohol you drink, and protect your skin. I know that's kind of a silly one that we don't think about all the time, but definitely wearing that sunscreen and a hat when you're able to. All right, next one. Yes, so wellness and preventative care. So like I was saying, those physical exams, mammograms, colonoscopies, pap smears, PSA tests, so those prostate blood exams, your routine immunizations, definitely included in your health plan. So definitely something to make sure that you're doing and going out and trying to do yearly. Mainly speaking to the men out there. Sometimes they're the worst at going, but definitely worth it. And then scheduling a visit is pretty easy. If you don't have a PCP doctor, a regular doctor, we can definitely help and finding you a doctor and just setting up that visit. And if there's any additional tests or anything that they want to do, they're able to go ahead and do that with you. I think I saw something in the chat. Wait a second here. There we go. Oops. Goodness gracious, this thing is touchy. I thought I saw something in the chat. Did you guys have a question before I move on? Oh, I think it was about audio. I've got myself up as loud as I can. Okay. All right. Well, I'll go ahead and keep going. But and then another important, as well as preventative care, is mental health. Mental health is just as important as your physical health. Poor mental health can lead to unhappiness, of course, relationship issues, missed work or school. And then something we don't think about is weakened immune system. So definitely want to make sure you're getting your annual checks. And if you are struggling with mental health, there's no shame in that. Definitely bring that up. And then definitely want to help you guys remember, you do have EAP visits. You have 10 free visits a year through Tanner. And I believe they were at the health fair last year, and I'm sure they'll be there again this year to give you guys more information if you're not as familiar with that. So definitely take advantage of that. That's great. Those amazing benefits. All right, go to the next one. Okay, and these are also just some resources out there for depression, anxiety, and mental health. These are just different ones that are available through Talkspace. I don't know if you've heard of that before. Bright Health. Again, these are additional on top of the Tanner benefits that you guys already have. So just something to think about. All right, and then finding the care that's right for you. So this is where you're able to find in-network providers. I believe I had a flyer with me last year on how to do that. If not, I'll bring it this year. So we have a DocFind site. You're able to do that, or you can call directly to our customer service line, the number that's on your ID card, and they'd be happy to help you find some in-network doctors as well. Okay, and then here's your tiers of healthcare. So you guys do have Teladoc. So that's 24/7 on-demand healthcare. I mean, I have a little one at home. So, the middle of the night, that seems to be, or on a weekend, of course, is when they seem to spike those fevers, get that sickness. So Teladoc thankfully is 24/7. You're able to call virtually with a doctor right there. They can prescribe you any medication if needed right over the phone and send it to your local CVS or other pharmacy if needed. Obviously doctor's visits, during normal business hours. And then something we do like to point out, urgent care versus ER. Definitely don't ever want to deter anyone from going to the ER if you are having a serious life-threatening issue. But if it's something that could possibly be done at urgent care, you're going to probably have a cheaper outcome than the ER. So definitely want to point that out of when to go to urgent care, when to go to ER. And I have another flyer on that. Happy to bring that during the wellness fair as well. But we'll go on to the next one. And then, like I was saying, Teladoc 24/7. We have an app. They have an app, so it definitely is easy to do right there through the app. They'll ask you, just some basic information about that you have on your ID card, and saves you time and money. I believe the copay is like $56 or something, but I think your plan covers it differently. But definitely it would be cheaper than trying to walk into urgent care or ER. I've seen it sometimes if the ear infection, 3 a.m, high fever, going to the ER. I mean, you're not walking out any cheaper than maybe a couple $100. So definitely a better resource for you guys. And then Minute Clinic. This is another one. And I know I passed out a flyer about this last year. Minute Clinic is no cost to you. So typically those are in CVS locations. If you have the CVS app, you're actually able to make an appointment with Minute Clinic. And it's just another alternative, just for those basic, ear infection, sinus infection, strep throat, things like that. They're able to go ahead and treat that right there. And again, no cost to you. And then they're typically in CVS. So you can get your prescription right there while you're waiting too. So kind of a one-stop shop for Minute Clinic. Next one is pre-certification. So this is something to keep in mind. So if you know that you're going to have any kind of hospital admission, an inpatient or even outpatient surgery, so IV home infusion therapies, chemotherapies, inpatient substance abuse, home health care, definitely try to call and see if any of those things require pre-certification. So you could call the customer service line, again, that's on your ID card. But just when you think of these kind of things that you're going to have to possibly do, definitely think pre-certification, because we want to make sure that's done prior to the services rendered, just because we don't want any delays in the claim processing. And this is just another layer of protection for you guys, making sure what's being done is what's considered standard. And things like that. But again, that's American Health Holdings is who does the pre-certifications for you guys. That number specifically is on the back of your ID card. But if you just want to start with customer service to see if what you're having scheduled or done requires that, they can answer that right over the phone for you. All right. And then next one, I think this might be a little difficult to see, so I do apologize if it's minimal, but I did want to kind of just go over basic. This is just, like I said, very basic, high level, between the core plan and the buy-up plan. So your core plan, your deductible for individuals, $4,000, families, $12,000. Out of pocket is $8,000 for individuals, $16,000. So of course you're responsible for everything prior to your deductible being met. And then once your deductible is met, then it's just that co-insurance. So your co-insurance is 30%. So that means after your deductible, we're going to cover 70%. You're responsible for 30% until your out-of-pocket maximum is met. Of course, like I said prior, preventative care visits, those are at 100% deductible waived. Please, please, please go get those done once a year. Physician office visits, you're looking at a $30 copay, and that's it. Your deductible does not have to be met prior to that. Specialist office visits is $60. This was a specific question that came up, so I wanted to make sure I included this. Chiropractic care, that is a $30 copay. Your deductible does not need to be met prior to that, and you have a visit per year. Urgent care is $75. Emergency room is $350 copay, then 30%. hospital inpatient, so your deductible needs to be met, then we're covering 70, you cover 30. Outpatient care, any outpatient like CTs or surgeries, whatever. Again, deductibles met first, then a 30% coinsurance. Prescription for the core plan is a little bit different. You have a prescription deductible. So for your generics, though, that's just a $15 copay. Then for your preferred brands, that's $45 copay after your RX deductible. Non-preferred is $85 copay after the RX deductible. And then the 90-day supply or mail order, $15 copay, no deductible. And then preferred is 90 after deductible, non-preferred $255 after deductible. So that's your core plan. And then out of network benefits, let me just touch on that really quickly. Obviously, you're getting the best benefit. If you're going in network, you're getting the best discounts if you're going in network. However, we do understand sometimes one of the doctors maybe you've been established with forever and ever and ever, they just happen to not be in network. You can make that choice to continue to see that doctor. You're just not going to have the best discounts and rates. So higher deductibles on the out of network, $12,000 for individual, $36,000 for family. Out of pocket is $24,000 for individual, $48,000 for family, and then it's 50%. So preventative care, 50% after deductible if you're going to an out of network. So definitely want to go in network. Don't pay when you don't need to. Physicians, everything else is pretty much at 50% after deductible, except for emergency room. That's always going to be paid at the in-network level for emergencies. And then same benefits for out of network for pharmacy. And then now let's move to the buy-up plan. A little bit richer, but so the premium's a little bit higher. But for deductible, you're looking at $2,000 for individual, $6,000 for family, out of pocket $5,600 for individual, $11,000 for family, and the coinsurance is a little bit richer as well, 20%. So same as the core plan. Preventative care is 100%. Your physician office visits are $25 copay. Specialist office visit is $50 copay. Chiropractic, $25 copay. Deductible does not need to be met first. And again, the 20 visit limit per year. Urgent care is the same as the core plan at $75. Emergency room benefit is the same, $350, and then 20% versus the 30%. And then again, hospital inpatient is 20% after that deductible. Hospital outpatient care, 20% after deductible. And then the buy-up plan does not have an individual pharmacy deductible. So just your medical deductible, it applies to that as well. So then it's all copays. So $15 copays for generic, $45 for preferred, $85 for non-preferred. Same thing, go with the mail order, $15 for generic, $90 for preferred, $255 for non-preferred. And then it's the same for out of network. And then your out of network benefits, again, higher deductibles, $6,000 for individual, $18,000 for family, $16,000 for individual, out of pocket, $33,000 for family. And then the out of network coinsurance is 40%. So everything is after your $6,000 or $18,000 out of network deductible, then it's covered we'll cover 60, you cover 40 until the out of pocket maximum's met. So I know that was a lot, but please let me know if you have any questions on that. All right, so next one, prescription benefits. I just wanted to include this information. So your prescription drug benefits are administered by Meritain Pharmacy Solutions, but it's powered by CVS Caremark. So I'm sure everybody's heard of GoodRx. CVS kind of came up with their own called Cost Saver. It's powered by GoodRx. There's nothing you have to do. There's no card you have to show. It's automatic. Once your prescription's sent to the pharmacy, the pharmacist is going to submit that claim using the CVS Caremark information that's on your ID card. And they're already going to do those drug comparisons in the background. That's nothing you have to do. And you're going to get the lowest price that's available. And then something else that we like to point out is that you have a diabetic meter program. So if you are diabetic, you can go to caremark.com/managing diabetes and choose the request a meter, excuse me. And then meters are going to be shipped to the member within 7 to 10 business days. So you do have that available just through CVS. So you want to make sure you know about that. All right, so accessing your benefits. So I don't know if anybody has a portal online, but it's a great resource for you. So you can just go to Meritain.com. And then, like I was stating earlier, customer service, they're there for you 7 to 7. And that's their general line right there, the 800-925-2272. But let's talk about the portal a little bit more. So like I said, you can register on Meritain.com. You'll just need your ID card and the information that's on the ID card to help you register. And we try to make it as easy as possible, as user-friendly as possible. So you can access it on your computer or tablet or your phone. We actually even have some apps. You can't find it on the app store. I'll bring instructions for that during the health fair on how to get that downloaded. But you're able to look up your claims history if you need an explanation of benefits, if you want to look at your full plan document and see exactly how things are covered. Eligibility, all your wellness resources. Let's say you lost your ID card, you need a new one. You can go ahead and order yourself one right off of the portal. And then reviewing your EOBs. This is so important. So obviously your EOBs is not a bill. We're just showing you how we process the claim for you. So this is huge. You know, if you're getting a bill in the mail from a doctor, you always want to check it with your EOB. If you think, okay, this is a little high or this is a little crazy, you can check your EOB to make sure it matches what they're saying you owe. So if we are showing that your patient responsibility is only $20, but they're billing you $50, that's when you can go back to your provider and say, hey, what is this additional $30 for? Because my insurance is saying I only owe $20. So something I definitely recommend doing and looking into. Of course, our customer service is always willing to help. And, you know, hey, I got a bill for like $200 something. Do I really owe this? If you're having issues looking at it or trying to figure out on the portal, they're willing to help you as well. But definitely want to make sure that you have that resource, you know, that, you know, you are able to see exactly what you should be paying and when you shouldn't. Right. And that is, I think that's all I had. Yeah. So does anybody have any questions? I know that was kind of a lot, high level, but please let me know if you have any questions. And I'll check the chat. Oh, looks like no info in the chat.
Morgan, if you could go over maybe some frequently asked questions that you received. I know for me, health insurance is very not only high level, but somewhat often confusing. So
Yes,
if
yes,
you
for
have
sure.
some standard questions that you typically receive that you could go over, that would be great. I don't know if they were addressing the presentation, but if there's anything else different that you can address. Oh, Steve said, is Tanner in network?
Yeah, so that doesn't go through your network at all. That's just something that City of Douglasville offers to you. I don't have their number or anything, but I'm sure Allison or somebody else could get it for you. But that's 10 visits. It's completely free. And so just another good resource for you. Great question. Great question. Some basics that I hear is, you know, deductibles and out of pockets. I know that can, you know, just kind of think about it like your car insurance too. Like your deductible has to be met before everything's not covered at 100%. You know, and then even after your deductible is met, you still have that co-insurance until your out of pocket's met. Once that out of pocket's met, everything that's in network, as long as you're seeing in network doctors, is covered at 100% for the rest of the year. Oh, preventative care. So Tanner is specifically an EAP program, you know, employee assistance. So it's just there for some, you know, somebody to talk to, like, let's say you're going through whatever goes on. And, you know, if you're struggling with, maybe mental health issues, divorce. They're gonna
I'm
kind of
sorry,
help.
Morgan. Can you hear me?
Yeah, I can hear you now.
Oh, yeah, that's not my question.
Oh,
I understand the EAP. My question is, my wife had a mammogram
okay.
done at Tanner, and we have been paying out the yin yang for it. And I'm trying to figure out why that is, if our preventative care is supposed to be covered.
Sure. I would probably have to look at her claim, but if they're paying for it, was it just her routine mammogram? Because those,
Oh, it's two. She went for her routine mammogram, and we had to pay some. And then they called her back for a second one, and we really got slammed on that one, which
okay.
which turned out okay, but thankfully, but uh,
Yeah,
we've already bottomed out our flex spending for the year because of this one procedure, and it
right.
seems like more should have been covered than was.
If you don't mind, could you email me? Here, let me put my email in the chat to everyone. If you could email me her name and then like maybe the date of service, if you remember. If not, I can probably figure it out. But what I'm thinking, oh, that was to just Allison, my bad. Let me try that again. What I'm thinking probably happened is maybe they saw something and they wanted to kind of do a deeper dive. So at that point, it's not considered preventative. At that point, they're concerned about something, so they're it's then turned diagnostic. So that's what I'm assuming probably happened. The first one should have been covered at 100%, just as a routine, mammogram, if that's what she came in for. But the second one, that's kind of what it sounds like happened there. If that
Yeah,
makes
that is what happened.
Yeah.
So I guess once again, my question is though, um, so the second one, okay, we have to pay for it, but do we have to pay for all of that, or is there any of that would be covered?
Yeah, if you don't mind, email me just kind of her name and some information or your ID number. Let me look into that and make sure it processed, and then whatever bills you guys are getting, let me make sure that that matches what we're seeing. So let me take that offline and look into that more with
Sure.
you. Okay.
Thank you. I'll do that.
Yeah, absolutely.
Thank you, Morgan.
Yeah, absolutely. Great question. Again, that goes back to the, checking your bills up against those EOBs. Listen, I tell my family that all the time. Everybody comes to me, Morgan, am I supposed to pay this? and I look into it because, yeah, that can happen sometimes. So definitely be, go in there. If you don't have a portal, if you haven't created one, I definitely recommend you trying to take some time out to do that. It doesn't take long. If you have any issues trying to create the portal, just call our customer service line. They actually have the ability to kind of screen mirror with you and see maybe if you're just accidentally typing something differently or something was supposed to be capitalized and it was lowercase. It can be a little finicky, but once you're in there, super user friendly, super easy to kind of look around and play around with. So I definitely recommend getting a portal. Um, Anything else? Does anybody else have any questions? I'm looking forward to the health fair again this year. Y'all really know how to do it. I go to health fairs a lot, and that one was awesome. I mean, cool space to be able to do it. You guys had a lot of cool vendors there. That's awesome. So I'm definitely looking forward to that, and I'll bring a bunch of flyers and information with me. And then some goodies to hand out. But I'm looking forward to it. I hope this helped. I know it's kind of high level, but I hope it helped at least. And then, like I said, I gave you guys my email in the chat. If you have something you want to talk about but don't want to talk about it in front of everybody, totally understand that. Just shoot me an email and we'll look into it for you.
Awesome. Well, like you see, Morgan, I don't see anything else coming through the chat. We
Yeah,
appreciate you giving this presentation today. This was very helpful.
awesome.
Um, as far as sharing this information, do you mind if we would send this presentation to the attendees today?
Oh no, absolutely. Please do.
Okay.
Yeah, absolutely.
Awesome. So everyone, you'll be receiving a follow-up email with the survey and also the presentation attached. We just want to know what you thought of this health and wellness workshop. We're looking to do more and get your feedback on if you find these helpful, and getting to know more about your insurance providers. And again, just as far as anything Douglasville University related, just make sure you read those upcoming workshops, the one tomorrow, and then February 26th and 27th. You can register with that, register for those in with CoAllender. So with that, that is all for today.
Awesome. Thanks, guys. Thanks for having me.
Thank you,
Yeah.
Morgan.
Yeah, absolutely. Bye, everyone.
Bye-bye.